Hi, Simon Chappell here. I'm the Quit Alcohol Coach, and as always, I'm here to help you smash your sobriety. If you enjoy the videos on my YouTube channel, there's new ones every Tuesday and every Thursday. Simply hit the red subscribe button on the screen and you can get notified every time a new video is released. And I would also love for you to check out my new quit drinking program. Simply visit joinbesober.com and you can get 14 days totally free. Today I wanted to talk about withdrawal symptoms. It can be a real worry for people when they quit alcohol as to whether they're going to suffer from withdrawals. Now, I was a heavy daily wine drinker for over 20 years. I was drinking anything from 1 to 3 bottles a day, often with beer or spirits on top. And I was kind of worried about whether I was going to suffer any kind of withdrawal symptoms. Now, the fact is that around 90% of people are psychologically addicted to alcohol as opposed to being physically addicted. Around 10% of people are physically addicted. Now, this means that when we quit, everything is in our heads. It simply means that we're going to need to make a change to our mindset and we're going to need to look at our beliefs in order to find freedom from drinking. This means that we also shouldn't experience really heavy withdrawal symptoms. Now, that doesn't mean they're not going to happen, but it shouldn't be a case of the more severe symptoms that are seen with people who are physically addicted to alcohol. And if you are physically addicted to alcohol, I do recommend seeking medical advice before you simply stop drinking. After I quit, I did experience some withdrawal symptoms. The main things that I experienced were disrupted sleep. I felt irritable and slightly depressed. My emotions were up and down. And I also experienced sweating and a little bit of shaking in my hands as well. This all happened over the first week or two, and then everything settled down. It faded away. And the only thing I was left with were thoughts in my mind about drinking, the occasional craving, and a kind of racing mind as my emotions were still up and down as my brain was recalibrating and rebalancing. They weren't the worst withdrawal symptoms. I'd expected far worse. And this tends to be the case for most people that I work with. The toughest thing that they tend to experience is a roller coaster of emotions. You might have seen my other video where I talked about how our emotions can be unstable after we quit drinking. And it's really important to be gentle with yourself, show yourself some kindness and self-love during that period, and accept that there is going to be a period of instability with your emotions. You might feel irritable, snappy, moody. Just know that that is simply a phase that you are passing through, and it will come to an end, usually after a week or two. Generally, after a week, we feel much more resilient, mentally tough, and really well prepared and set for success as we go forward. So it's very much a case of getting through that first week. There are some other withdrawal symptoms that we can experience when we're psychologically addicted to drinking. There can be feelings of tiredness. That's a really common one where people aren't sleeping properly. They're moving into a new type of sleep, which is actually the proper restorative sleep that we should be getting without alcohol in our lives. But that transition can leave us feeling really tired. And as I say, the first few nights after we quit, generally you're tossing and turning in bed, and that's going to leave you feeling tired, which of course can lead to irritability. Anxiety can be increased, and we can feel slightly down and emotional as well. So don't expect nothing. If you come into this expecting some level of discomfort, then you're going to be well prepared and well placed for anything that comes up. I've also known people suffer from headaches and migraines after they quit. So it's really important to make sure you're drinking around 2 litres of water every single day. That's a great practice anyway. And of course, when you quit, your skin improves without alcohol going into your body. So drinking water is only going to help the elasticity of the skin, the hydration. It's just going to make you end up in a much better place, and it will certainly help with any headaches or migraines. So make sure that you've got a hydration plan. I keep a water bottle with me at all points during the day, and I just sip on it as the whole day goes by, and it's a great way to make sure you get plenty of hydration. Some people can also suffer from a loss of appetite when they quit drinking. That can be fairly common, and it's important to make sure you take steps to look after yourself. If you're suffering from a loss of appetite after you've quit, I recommend just having small snacks throughout the day to keep yourself full. You might have heard of the phrase HALT, H-A-L-T. It stands for for hungry, angry, lonely, tired. And these are the points where we can feel triggered to drink, where the cravings can feel really strong. So making sure that you don't remain hungry, even if you've got a loss of appetite, is really important, because that can just come out of the blue if you've not been eating properly. If you don't feel hungry, an alternative is to have protein shakes or meal replacement shakes. These can be a great way to make sure you're getting the right level of proteins and nutrients, even if you don't fancy eating a big meal. But again, take the time to notice, and if you find that you've lost your appetite, do something about it to ensure that you are getting the right level of nutrients and proteins into your body. Some people can also suffer from heart palpitations and heightened blood pressure. This settles down generally over time. If you're finding that it doesn't settle down after a couple of weeks, then I recommend seeking some medical advice around that. I had a few heart palpitations in the early days, but after that, there was no recurrence of it. But just keep an eye on it, because this isn't something that should go on and on past the first couple of weeks. Now, people who are physically addicted to alcohol can experience much more severe withdrawal symptoms, and it's important to keep your eye out for these. I do encounter people who are really worried about just stopping drinking. Now, let me tell you, if you're drinking like I was, which was 1 to 3 bottles of red wine every single day, you're probably not going to have any issues if you simply stop. It's more likely that you're going to encounter problems if you're a really heavy drinker. Very heavy drinkers can experience much more severe withdrawal symptoms, and the worst of all is called the DTs, which stands for delirium tremens. And they can be really serious, and in the worst cases, they can be fatal. Now, it's important to say that probably only 5% of the most severe heavy drinkers actually suffer from these. And in most cases, they're treatable. But it's important to know what the symptoms look like and what you should watch out for. I don't want to turn this into some kind of scare video, but it's important just to know what might happen in order that you could seek advice if you noticed any of these things going on. The common signs of DTs would be a sense of confusion, light sensitivity. So if somebody looks at the light, it seems painful or uncomfortable to look at. There can also be breathing difficulties, severe tremors and shaking can happen as well. And people suffering from DTs can also suffer really heightened irritation and anger, much more so than somebody who's psychologically addicted. They might also encounter sickness and vomiting too. And in severe cases, it can lead to hallucinations and even seizures. As I say, DTs can be fatal in the very worst cases. So if you notice any of those signs, make sure you seek medical attention straight away. But the important thing to note in all of this is most of the people that I work with, the main kind of withdrawal symptoms that they suffer from are cravings for alcohol. They suffer up and down emotions, disrupted sleep, maybe low moods and sort of irritation in terms of their day-to-day life, alongside strong cravings to drink. You've got to know that after that first week or so, those cravings subside. I found that after I quit, I was being hit with cravings every few minutes. It was like I was standing on a beach and waves were coming in and hitting me, and then they were going back out again, and then another one had come in and smash into me. After the first few days, they were less and less frequent. After a week, it was probably happening every couple of hours, and then it just became less and less frequent as time went by. So in most cases, over 90% of cases, we do experience some form of mild withdrawal, but it's not enough for you to think this isn't worth doing, this isn't something that I want to go through, because the benefits of quitting drinking far outweigh that week or so of discomfort. And you've got to know this. You need to stand in that storm to come out the other side. And let's be honest, it isn't really a storm. There is some discomfort. I'm not going to hide that from you or sugarcoat it, but what's on the other side is a beautiful gift and a wonderful new life in an alcohol-free world where you will start to appreciate everything about your life so much more. It really is worth sticking with that level of discomfort for a few days to find out what happens 3, 4, 5, 6 weeks after you quit drinking. So prepare yourself. Know that you are going to probably have some form of mild withdrawal, but it really is going to be worth it. See it as a sign that your body and your mind are healing and recalibrating. Know that that is part of your path to freedom from alcohol, and embrace it. welcome it in, get it all down in your journal, and notice that it's getting better and better as the days go by.